Okay, your child has experienced their first period, a milestone moment marking adolescent development. Now that you've provided some pads, given them a hug, and maybe some chocolate, what should you expect next? For the first year or even 2 years following onset of periods, it's pretty typical to have irregular periods. Normal range for days between periods is 21 to 45 days based on counting from the first day of one period to the first day of the next period. Periods last between 3 to 7 days, and people usually use less than 6 pads or tampons in a 24-hour period. It can take a few years for the cycle to work efficiently, but by 3 years after menarche, or the first period, about 60 to 80% of cycles occur within that expected range. Here are a few things to watch for. Your child should see a doctor if there's a gap of more than 90 days between periods. If menstrual flow is especially heavy, requiring more than a pad or tampon every hour, you should also seek care. Here are a few other things to watch for. If they're 15 and haven't started their period, or if they have had their period for more than 2 years and it still doesn't come regularly, about every 4 to 5 weeks. While some cramps are normal, if teens have severe cramps that don't get better, even with ibuprofen or naproxen, a doctor can provide some additional suggestions and options. If periods last longer than a week, or if any PMS symptoms cause your teen to miss school or other activities on a regular basis, it can be very helpful to look into medications such as hormonal contraceptives that can help. Over years of gradually losing blood through menstruation, teens can develop anemia, especially if they don't consume enough iron. Iron-fortified cereals, meat, seafood, seeds, and nuts are all good sources of iron. All right, so what if your child hasn't started yet and you're wondering when it might happen? Typically, this happens about 2 years after breast development begins. On average, periods start around age 12. If they haven't started their period yet, but you think it might be soon, this is a perfect time to start normalizing the experience, discussing pads and tampons, getting prepared for this completely normal and necessary next phase of development.